Hello and welcome to another edition of Tuesdays with Liz, a disability policy for all. Today we are continuing with our three-part series on health, care, and disabilities. I'm happy to have as my guest Stephanie Meridith, who is one of our members from the Kentucky UCEDD. Today we are going to talk to her about how healthcare is important to her and her family. So welcome, Stephanie.
Hi, Liz. Thanks so much for having me.
The first question is, as I said, you work for the Kentucky UCEDD, and I wanted to know, can you tell us what you do there?
Well, like a lot of members of the network, I have several different roles at our UCEDD. So one of my roles is as Information Services Director. So I'm responsible for social media and the newsletter and the articles on our website, things like that. And then I just started on a new employment grant that's exciting because we are documenting or creating resources for people transitioning from high school to college to employment. And I have a 16-year-old son with Down syndrome, so that's really an exciting one for me because I'm living it in real time and also getting to create resources for other families. So that is another one of the projects I work on. And the final project that is really key to what I do is creating materials for new and expectant parents learning about a prenatal diagnosis of different genetic conditions. So we have a National Center for Prenatal and Postnatal Resources, and I'm the Medical Outreach Director for that program. And we've historically created materials about Down syndrome, but have now expanded into other conditions like Turner syndrome and Jacobson syndrome.
Okay, great. That sounds so interesting. The next question is, we heard that you were invited to meet with President Obama. Tell us why you were invited and what story did you share with him?
I was actually invited to the meeting between President Obama and Vox when they were doing the interview about the impact of the Affordable Care Act and his summary of that. And they had invited about 5 to 10 families who had written to the president about their experience. And mine really just started with sending a thank you note. About a couple of months ago, I decided just to let him know how much the Affordable Care Act had helped us personally as a family. Before the passage of the ACA and the ability of people with pre-existing conditions to get coverage, my husband was self-employed, and as was I was a contractor. And so we were unable to purchase a private policy for our son with Down syndrome at any price. They just wouldn't sell a policy to a person with Down syndrome. Now, fortunately, we lived in Georgia where they had the Katie Beckett Medicaid waiver, and we were able to qualify for that. But when we had lived in Utah, we had to purchase into a high-risk health pool, which was really financially crushing for our family. So to have that opportunity to buy a private policy for him was really important to us. And then also, I was personally waiting for a surgery for 2 years that I needed to have done. And I couldn't get it done because of a pre-existing condition loophole until we were able to get an Affordable Care Act policy. And so I just wanted to let him know that coverage made a difference in our lives, because we know that people, our leaders a lot of times get criticism for how something isn't working. And I just wanted to let him know that for our family, it was really meaningful and helpful to us. There were lots of families just sharing their personal stories and who had written notes of thanks to the president. And it was really amazing because I got in this email from the White House, and I didn't think it was real, you know? And so I sent it to Andy Imperato to say, is this something that's legitimate? And he checked on it for me and said, yes, no, this is a real invitation to go to this event and would be a great opportunity to share our stories. So
that's great. And I love the fact that you thought that it was fake.
I know. Well, who thinks they're going to get an email like that from the White House? And they actually sent a follow-up email saying, oh, no, are you coming? Because we need to know the RSVP numbers. And so it took the second email, and the representative from the White House said that was pretty common, that many people don't believe the first email. They think it's spam or something.
Thank you. How can other families and network members share their story about healthcare policy?
I think really we need to share our stories wherever possible, and that may be on social media, letting your friends know that what kind of healthcare challenges you're having and what policies are helpful to address those challenges. I think letters to the editor in newspapers, meeting with our legislators and letting them know what's important to us, and letting them know that perspective of a citizen, because I think a lot of people don't realize that certain conditions weren't covered under the pre-existing conditions clause. Because, you know, I had a friend just yesterday at a basketball game when I had shared our story on Facebook and what had happened. And she said, you know, I never realized that people with Down syndrome could just be denied health insurance because of their diagnosis. And so that was really important to her because they care about our family. And so I think we need to give a lot of credit to those around us, that they care about us, and to share our stories so that they know the importance of our healthcare issues. And I think also to attend town hall meetings and any kind of place where we're allowed to, where we're given the opportunity to share our stories.
Thank you. And the final question is, do you have a final message that you would like to share with the audience about how sharing your story is so important?
Well, I think it goes back to people just not having an understanding that that our families may face some additional challenges with accessing healthcare, and making sure we're sharing that story in our conversations, on our social media, and in those daily interactions that we have with people. So part of my work at our UCEDD is sharing information with new and expectant parents who are learning about a diagnosis, and even our families who have, you know, children with disabilities. If their kids are under 8 years old, they don't realize that some of these conditions weren't covered prior to the Affordable Care Act. And so it's important for people to know what was considered a pre-existing condition before, and how that caused challenges to people, or how it was challenging to have a price cap. I was just talking to my friend yesterday on the playground whose daughter has cystic fibrosis. And she said, you know, with knowing that there was a $2 million price cap on their health insurance policy, it would make it challenging for them to make good decisions about healthcare, because they said, you know, we'd have this opportunity at a certain technology to help her, but we'd have to think, well, do we want to invest in that now? Or do we want to wait and see if there's something better, because we don't want to spend all of our lifetime maximum? And so people were having to make those kinds of decisions that could really impact the health of their kids. And it's important for people to know that. And so in my situation, I had a COBRA policy after I had Andy, which extended my employer health insurance plan. And they said, well, if there's a person on the policy with a disability, you can get an additional 11 months. And so I got pregnant with that understanding. And then they said, well, you can only prove disability with a Social Security award letter. But because he was a child, he didn't have that. because he was disqualified because of our income. And so they ended up not giving me that additional 11 months. My baby was due April 6th. My policy ended March 31st. And I had to ask the doctor to deliver me early. And in that delivery, we both went into distress. And all of that was because we were making a decision based on insurance and not actually because of the best interest of our health. And it's important for people to know those stories so that they know what really impacts people. So I think our legislators a lot of times don't realize that. Our friends and family might not if we don't tell them. And so they need to know what the impact of good health care and health insurance means for us.
Wow, I didn't even know. So thank you very much. Please remember that next week is the last week of the third part of our special series. So please look for that next week. And if you have any questions about this or any other policy issues, please go to the AUCEDD webpage and look for this week's In Brief. And if you have any questions or comments about this edition of Tuesdays with Liz, please leave them in the space below. Thanks again, Stephanie. Bye.